This program is paid for by Your Radio Doctor, LLC. All opinions or statements expressed on this program are solely those of Your Radio Doctor and their guests and do not reflect the opinions of WPHT or Odyssey. Your Radio Doctor does not recommend or endorse any specific tests, products, physicians, procedures, opinions, or other information that may be mentioned on Your Radio Doctor. Always consult your own physician.
Good afternoon and welcome to Your Radio Doctor. I'm your host, Dr. Mary Ann Ritchie. It's also Heart Month, a good time to reflect on your own numbers like your weight, cholesterol, blood pressure, minutes of exercise each week, and the need to learn CPR. Well, today our topic is not about adults, but children. We don't often think that children are at risk, but in fact, quite often when a child experiences cardiac arrest, it's not from heart disease, it might be from aspiration or drowning. Today we have two outstanding guests. First, we'll hear from a proud daddy of four beautiful little children. Mr. Frank DeSimone experienced a terrifying ordeal when his 1-month-old tiny boy, Luca, exhibited sudden cardiac arrest, and Frank's quick reflexes to do CPR saved his baby's life. We're also joined by Dr. Victoria Vetter, professor of pediatrics at the Perelman School of Medicine at the University of Pennsylvania. She's an electrophysiology attending in the Division of Cardiology and the director of Youth Heart Watch at Children's Hospital, Philadelphia. Dr. Vetter has an international reputation for her research related to abnormal heart rhythms and sudden cardiac arrest in children. She's published numerous articles and books, held multiple leadership positions in every national pediatric organization, received countless awards for her research, her teaching, and her humanitarian service, and she holds the Evelyn Rome Tabas Endowed Chair in Pediatric Cardiology at Children's Hospital. Welcome, Vicki and Frank.
Thank you. Thank you.
Well, each week we highlight a person who's faced adversity with true courage or does great community service. And this week, Frank DeSimone is your real champion. Frank, your precious triplets were born prematurely at 32 weeks on August 3. And we say at 32 weeks, that's the magic point that we strive to reach.
That's right.
What happened on September 6th?
Well, thank you, Mary Ann, for having me. It's really an honor and quite humbling to be here. I was thinking back on the drive down to just a year ago when we didn't even know we were pregnant, let alone having triplets. So quite a lot has happened in the last year. There's really nothing that prepares you for the shock of having triplets, right? That's not news that any parent expects to hear. But, I think it's interesting once we learned that we'd be having 3 babies, you're prepared for any number of things, right? You worry about everything that might happen. The doctors prep you for the risks. But then when they were actually born on August 3rd, even though it was premature, we had been prepared for that. We had taken a tour of the NICU. We sort of knew what to expect in the NICU. Our doctors were just wonderful. And so when they were delivered and they were all healthy, we kind of thought we were through the worst, right? Good. We sort of thought, all right, we've arrived and now we just have to figure out the next, 30 years. But, everything was going well. They were all healthy and we were bringing them home. So our son, Luca, was the first to come home. He was the strongest of the 3. The big test for the triplets to be discharged from the NICU was their eating ability. And so Luca was the first to really eat from bottles consistently. And so he came home. He was with us for a week. The second came home then about a week later on September 5th. That was Eleanor. And we were just one day away from having the whole gang, reunited at home and starting the rest of our life. So it was the morning of September 6th. Obviously, we'll never forget the day. It was the first day home with 2 babies home. And my wife, Elizabeth, went back to the NICU to visit the 3rd baby to start to get her ready for discharge. So I was, feeling really optimistic. I was going to feed these 2 babies and, prove that everything was fine. And so I fed Luca and put him down. And I went to change Eleanor to get her ready. And I just heard, a noise like a gurgle or just something seemed wrong. And I looked over and I could see that Luca was in distress. I saw a little bit of spit up and I said, gosh, I hope he's okay. I hope he just spit up. Let me go and make sure. And I could just tell right away that he wasn't breathing. His color was already changing and, panic just immediately set in.
And you had a nurse there helping you because, as you say, Elizabeth, Frank's wife, was at the hospital visiting Clara. Luca and Eleanor were there. And what was your first instinct? You picked him up and what?
I mean, it's sheer panic, right? you think this can't really be happening to me. You think surely this is going to resolve itself. But the worst feeling was that I thought he looked like the baby I had seen in the CPR video, right? The color was changing, and that was the first thing they told you to look for. So I knew I didn't have a lot of time to act, but I think, somewhere deep down I said, well, if I start doing CPR, if I call 911, it's going to really make this real. And this can't be happening to me.
Right.
Surely I'm going to tap him on the back and he's going to spit up or he's going to start breathing again. And so I tried that. It didn't work. And then ran to get the nurse who I mentioned was with us and just said, I think we need to call 911. And that's what we did. So I had her dial the buttons. I started CPR. And, thankfully the dispatcher was amazing. You watch all these crime shows, and I think we think about what a 911 call would be like, but this dispatcher, was calm and really just coached me through, and thankfully was sort of reinforcing what I was already doing, which we could talk about.
And I think we've done shows on when to call an ambulance. Don't try to drive your husband or wife or who's having chest pain, because if they need CPR, you can't drive and do CPR. Go for the ambulance. But the great thing you did was leave it on speaker.
That's right.
So you could communicate. That's another thing we always impress upon people. We can all multitask, but not in a setting like that. So they were telling you to do 30 reps only. This is a little tiny baby. So
That's right.
33 days after you brought Luca home, and how much did he weigh at birth? 3?
Oh gosh, yeah,
10?
he was about just under 4 pounds. So at this point he was not even full term.
Right.
He was only 36 weeks gestation, essentially 37 weeks gestation. So he was a tiny
Teeny-weeny little
guy.
boy.
Yeah.
And I pictured when we talked, because as Frank is part of a family we've been friends with for years, and I knew that they were having triplets, and I talked to his mom on a regular basis. How are we doing? Because of prayer, they were born on your parents' anniversary,
right.
which made the
wedding
gift even more special. And I pictured that you put fingers on this little 4-pounder, maybe 4.5 pounds by that week. So I brought with me llama, red pajamas, with all the dolls and things in my house this morning I couldn't find, but he's in red for Valentine's Day.
He is.
Could you demonstrate? Because this is something our listeners, this is on YouTube, people should see what he did.
I obviously missed the memo on wearing red today. Here in the Philadelphia area, I wore green to support our Super Bowl champions.
Eagles. Go Eagles.
Red, unfortunately, is the heart month color, but
It's all good.
But no, listen, this is certainly easier than the real thing. But, most importantly, you want the baby, the child, flat on their back. And then the big difference, I think for those of you who have taken a CPR class, or maybe you've seen it on a TV show, a lot of us think of the hands interlocking, those chest compressions under the rib. The baby is much smaller, of course. And so what you really do is just take your 2 hands behind his or her back. And I just used my thumbs. And it was just 30 compressions, and then two breaths of oxygen, in his mouth.
And another important distinction, in recent years, the CPR classes say the most important thing is get the blood flowing to the brain, to the heart itself, to the kidneys, all the vital organs. Don't worry about the breaths, unless it's a child or the episode occurred around drowning and the person's lungs obviously are filled with water. So what's really great as well is that you had the CPR in your head. It's about muscle memory. You get there, you panic, but you have to know where the brake is when the truck starts to roll down the hill. So you went with what you knew.
That's right.
And you said probably, when did you take the CPR course? Was that part of your prenatal training?
Yes. So this is where my wife gets a lot of credit. She gets a lot of credit for a lot of things. But for this particularly, yes, when our older daughter was born, we have our older daughter, Grace, just turned 2 this last week. My wife said, I really think we should take an infant CPR class. And there are a number of organizations that offer them. We took one through Mainline Education, or Mainline Family Education. I think they have a variety of infant courses, pregnancy courses. So it was about a 2 or 3 hour course. We went out to Devon one night. They have some videos. They have you with the mannequin. They have some coaches in there. But I think, as you might imagine, if you've ever taken a CPR class, I think what's on the back of your mind is, could I do this? Sure. But A, this is never going to happen. And B, if it does happen, surely I will be somewhere where someone else would be able to do it, right? I'll be at the mall, I'll be at the supermarket, and there will be someone trained who can step up and do it. And that unfortunately is not the case. You may be alone in the house with a family member. And
you put that dear little baby in an ambulance. And what was going through your mind,
It
Frank?
was probably the worst moment of my life. I mean, I think, becoming a parent is a beautiful thing. It's also an overwhelming and challenging thing. And I think, you're an experienced parent, as you know, you raised 3 amazing children. But we all have lessons in parenthood. And I got one, very quickly. Look, he did not look good. I really did not think I was ever going to see him again. He was blue. He was covered in vomit, and it was just a horrible sight. And there was a moment where they had him in the ambulance where we weren't sure what was happening. There was a question of, is this ambulance even going to go anywhere? Thankfully, they did. Thankfully, we live close to Bryn Mawr Hospital, so they got him to Bryn Mawr Hospital. They got him stable. But even at Bryn Mawr Hospital, where there were just some unbelievable doctors and nurses. I mean, first I have to give credit to these EMTs. I mean, I can't say enough. And one of the big things I wanted to emphasize today is, please, whatever community you live in, recognize your EMTs, support them however you can. I mean, these people are absolute heroes. To run into a house where they've never been, with a family in complete crisis, with a little baby in a life and death situation, and to be able to just throw themselves into that situation is unbelievable. So they did an amazing job. And then, of course, Bryn Mawr Hospital, same thing, doctors, nurses, technicians. But even they, at that moment, doctors that we knew because they brought down several from the NICU who had been with us for the last 4 or 5 weeks. Some of them knew us very well and came out and said, guys, this doesn't look good. He's been in cardiac arrest for at least 45 minutes. I was only doing CPR for about 5 minutes, maybe. I don't totally remember. The CPR continued. He was intubated. He was in cardiac arrest with no pulse. And they said, look, he's alive, but we have no idea what condition he's going to be in. So that's where we were. I really did not think, I thought we were going to lose a son. And I that whole day, we got him down to CHOP, and I just remember thinking, I was prepared for everything in the womb. I wasn't prepared for this. How do I now go through my life with these other kids that I have to be there for? What does this mean for us? It was just a horrible, horrible day. But thankfully, we have a happy ending. So.
And Frank, listening to you, I listened to your mom. We chatted before. What a bond you have for eternity. You love all of your children, but when you walk into the fire with one of your children, you're melded together for life.
There's no question. Everybody talks about that moment where they see their children for the first time and what you feel. But seeing him when he opened his eyes again and when he looked like himself again, I mean, that was so powerful. I mean, there was nothing more gut-wrenching than having him in my hands and thinking, I might not be able to do enough. But I feel like with him, I've already sort of done the most important thing I'll ever do in my life, right? Yeah. I gave him a chance, along with many other people. I played a small part, but I feel like, no matter what happens, I've done something for
you gave him
and
the gift of life.
When he gives me a hard time when he's a teenager, I'm gonna remind him of that. He's not gonna want to hear it. But
you want me to do CPR on you right now?
But he just is, right now he's the smiliest, happiest baby.
And he's a chubster.
He's
How much
a chubster.
Does he weigh now?
He's about 16 pounds now. He's got
nice.
big cheeks, and it's funny. He has to wear a helmet because he's got a flat spot on his head, so he's in the helmet. So this weekend when we had him in the Eagles jersey with the helmet, sort of said, he's ready tonight. If any of these Eagles players go down,
he's the man.
we'll put him in.
He'll either be a ballerina or a WWF, one of the two. He's a tiger.
No, he's amazing. But I think the big lesson that we learned from this experience, why CPR is so important, is even though his heart had stopped, even though he had no pulse, oxygenated blood was getting to his brain. And so the big takeaway here is when he was in the ICU down at CHOP, there was this big question, well, what condition is his brain going to be in, right? And of course we thought about, is he going to be paralyzed? Is he going to be disabled? We were so nervous for that first MRI. He has a bleed in his brain. He had a bleed in his brain. It's receding. It's healing. It's doing everything it's supposed to do. There was no permanent brain damage. There was no ischemia in the brain. And all of the neurologists that we met with said that was because of the CPR. Mm-hmm. So the most important thing you can do is keep pumping that oxygenated blood to the brain. Even if it looks like things are not good. He didn't have a pulse. I don't know how long, but it kept his brain alive. And the other interesting thing is that, babies' brains are incredibly resilient. You would think oh gosh, this little baby, how could he survive something like this? But actually, babies' brains are very plastic, and they're still developing.
Yeah. Neuroplasticity is a
Exactly,
real thing.
yeah.
So you had your fingers on his sternum, on
That's
the
right.
breastbone. So for our listeners, we thank Trish Bradley's here today from the American Heart Association. You can go on heart.org is the website and find CPR classes anywhere, any communities, Narberth Ambulance near us.
Absolutely.
Or you mentioned that you took a lesson in Wayne. Incredible story, Frank. Thank you for sharing. That's a tough one to get through, and you relive it, I'm sure, every time you talk about it. So God bless you and those beautiful little babies. And Luca,
Thank you.
St. Luke means light.
That's
so he
right.
will be the light in your life forever.
That's right. Look, I wish we had never had to go through this. I wish this little boy had never gone through this, but I do think his story has inspired a lot of people. And I think if this message of taking the CPR class resonates with anybody, this has served a bigger purpose. for
CPR,
sure.
CPR, CPR.
Yeah, that's right.
Let's take a little break, and when we come back, more about sudden cardiac arrest in children. Welcome back to your Radio Doctor. We're so pleased to have very special guests today talking about sudden cardiac arrest in children. After that riveting story from our friend Frank DeSimone, he saved his little 1-month-old baby's life with CPR. How many times do we have to be convinced the importance of CPR for adults and children? I'd like to introduce everybody again to Dr. Victoria Vetter. She's a pediatric cardiologist from Children's Hospital. And Vicki, sudden cardiac arrest, how common is that in children?
Thank you for having me here, Marianne, and thank you, Frank, for telling your story. One of our main messages that through the American Heart and through the Children's Hospital that we try to get out to everyone is that with CPR and AED use, you can save a life, and you certainly did that. So thank you for sharing that with all of us. Sudden cardiac arrest is one of the most common events throughout the country. About 350,000 people overall experience sudden cardiac arrest. What folks don't realize is that about 10% of these are under 40 years of age. And unlike measles or mumps or some of those contagious diseases, we don't count how many children have a cardiac arrest. So there's no way to know exactly how many this is. But from various databases, we think that it's somewhere between 10 to 20, 23,000 children will experience a sudden cardiac arrest. And if that's your child, that's 100%. So it's very important, regardless of the numbers, that people are aware of this and understand that it is an event that can happen to any child at any time. So we need to be prepared.
But what's interesting is when we were chatting the other day that as a pediatric cardiologist, you told me that it's more often non-cardiac as a cause. In children, anyway. That it can be from a cause of a heart defect, from a congenital heart defect or an abnormal rhythm, but so many times, like Frank's baby, it was respiratory. The baby probably aspirated.
Right. Well, overall, cardiac arrest can follow respiratory arrest. A sudden cardiac arrest is more commonly from a cardiac cause, but it can occur after a respiratory arrest, which is probably what happened to Luca. And so it's important to understand that it can happen from an electrical cause, an electrical abnormality in the heart, or from an abnormality in the heart muscle. So electrical causes can be conditions that have big fancy names, but basically long QT syndrome, short QT syndrome, Brugada, catecholaminergic polymorphic VT, and because that's so hard to say, we say CPVT, or from idiopathic ventricular fibrillation. All it means is the heart suddenly stops beating, starts to quiver, and blood and oxygen is not provided to particularly the brain. But you're right that we have about 5 minutes worth of oxygen in our blood cells. And so by doing the compressions, we push that around to the body. I'm very glad that Luca did well with the compressions, but generally when you take the courses, you will be advised to do rescue breaths with children. So do whatever you can do, but when we get to how to do this, we'll talk about why that's important. So as far as causes, the electrical causes, then we get to the structural causes or the cardiac muscle causes, and most people have heard of cardiomyopathy. In the local area, people may remember Hank Gathers, who unfortunately had his cardiac arrest on national TV, and that was because of a cardiomyopathy. there can be cardiomyopathies that occur for other reasons, and 80% of these electrical and cardiomyopathy conditions are inherited. So it's important to understand and to know your family history, because it may be that the father, the mother, or a grandparent, or even sibling cousins may have a similar condition. So that's an important part of a pediatrician will ask you to know your family history and to tell them if there's been anyone who has died suddenly from a cardiac arrest or has died suddenly under the age of 50. That might be from a motor vehicle accident that's unexplained, a sunny day, no rain, no snow, from a drowning, or from a sudden infant or sudden unexpected death. And about 10 to 15% of those are from these electrical abnormalities.
So when you say electrical, it means we all have a natural pacemaker, and if it cooperates, it makes your heart go lub-dub. And every time your heart does that, it goes a good push, sends the blood out. If your heart's quivering, and people have heard of atrial fibrillation, ventricular, your heart's doing this. It's not bench pressing the blood out the way it needs to. You drop your blood pressure and bad things can happen. So when we talk about cardiac abnormalities, some are congenital, maybe there's a hole in the heart and the blood's not flowing the right direction, or this electrical pattern might not be cooperating to give you a good lub-dub. Cardiomyopathy, pathology, abnormal, the muscle of the heart, myo, cardio, heart muscle pathology, the heart's not strong enough, either from a virus somebody's had, or so all these things go into the mix. How can we identify this before there's a problem? How can we, because some people have, the first symptom is they have a cardiac arrest. Other
Correct.
people, they might have that would give us a clue to look further and do an echo or do further studies.
Right, so many of the conditions will not have any symptoms. 50% of the time, the first symptom is a cardiac arrest. And with children, you learn that they think that whatever they're feeling is normal, so they often don't tell us when they're having chest pain or they're having rapid heartbeats. They just think that that's what's normal. So the symptoms that are present 30-40% of the time, but may be ignored, are chest pain during exercise, fainting during exercise, repetitive fainting, especially with activity, palpitations, rapid heartbeat that's not just from running around, or extreme fatigue, shortness of breath during exercise that's something new. So any of those symptoms, you should tell the pediatrician, the child's doctor about them and let them be checked out. And what would they do if they hear that or hear that there's a family member that's had an event when they're young, is they would get an electrocardiogram. And 80% of the time, we can find these conditions, the cardiomyopathies, the electrical conditions. We may not find there are abnormalities of the coronary arteries, not coronary heart disease where the coronary artery is blocked, but an abnormality where the left coronary might come out of the right, and to get to the left ventricle, it has to pass through the two big vessels, the lung artery, the pulmonary artery, and the aorta, the artery that goes to the body, and it gets squeezed when you're exercising, and you can have a cardiac arrest then. There's no way to find that with an electrocardiogram. Sometimes we suspect something, person's having chest pain with exercise, and we would get an echocardiogram. And so an echocardiogram is an additional test that we can do to find some of these structural and muscle-related abnormalities. You're right, you can get an infection in the heart, what we call a myocarditis, an inflammation in the heart, and that can be caused by a virus, most commonly. And so that can be picked up on electrocardiogram, but the changes can also be seen on an echocardiogram. And then we may need to do more extensive tests like an MRI or additional studies once the patient gets to the hospital.
And I think myocarditis, an inflamed heart muscle, became more familiar to people with COVID. We were seeing it not frequently, thank goodness. But I want to go back to family history, because those clues can be so valuable if you think to report it, or if somebody thinks to ask you, gee whiz, we're looking at possible heart problems with your child. Anybody die at a young age without an explanation? They just passed out someplace, or they fell asleep at the wheel and they weren't tired. They hadn't been up all night. There wasn't a good explanation. Why did this person fall asleep? Did they drown at a young age? All these things make us scratch our heads, and or has there been anybody in your family who faints when they exercise? Because we're putting a person literally on a treadmill and asking the heart to pump more quickly, and it's just not able. Tell us about that a little bit.
So the family history is what you'd like to hear about? So there are a number of conditions. Most people, unfortunately, don't know, and they assume that if a person has had an event where they pass out, it's important to recognize a sudden cardiac arrest. So the person, as you said, looks different. They're not moving. They may not be breathing, but they may be breathing in an unusual way. They're not breathing normally, but they may be having what we call struggling or agonal breaths, and they may be having some shaking movement. So sometimes someone thinks that it's a seizure. So you need to recognize that it is a cardiac arrest. But if someone in your family has had an event, it may have been a heart attack, but don't assume, particularly if they're young, that it was. It may have been one of these cardiomyopathies, the electrical condition. Marfan syndrome is another condition that runs in families, and these are the very tall basketball players. There was a Olympic volleyball player, Flo Hyman, who had Marfan syndrome and had a sudden cardiac arrest on the volleyball court. So if any of those things are present in your family's history, it's important to tell the doctor about that.
Well, we talked the other day, there are certain triggers for abnormal heart rhythms. We talk about energy drinks. Oh my gosh, how much caffeine can be in some of those energy drinks. And we talked about the student at Penn not too far back who died because after drinking a caffeinated beverage with 390 milligrams. A regular cup of coffee is about 100 milligrams of caffeine, thereabouts.
Around 80.
You don't want to go over 400 a day. But here's a student who drank it all at once, or I won't mention any store brands, but they'll promote, drink this and your eyes will be open for the next 62 days. And you drink that caffeine, and that can stir up somebody who has a propensity to go into an abnormal rhythm, yes?
Right. So the 400 milligrams is for adults, and even though that's been used and that came from our Canadian Health Canada neighbors, it's probably not a good thing, and no more than 200 at a time. But I think a lot of us maybe have a cup of coffee in the morning. That should be enough. We advise through the American Academy of Pediatrics that children and adolescents should not be drinking coffee at all. So they should not be going to the convenience store and picking up a can that has 800, 200, or 400 milligrams of coffee. And when you go into while coffee is regulated, energy drinks are not regulated. So you have to understand that the FDA has no control over them unless they are claiming to be a drug, which they're smart enough not to do. So we are trying to raise awareness that this is something that children should not have, and that as adults we should be setting good examples for our children, our grandchildren, by not taking them into Starbucks with us. Or any of the other coffee houses that are around. All of the fruity drinks, the pink drinks, they have a ton of caffeine in them, and it's important for children especially to stay away because they don't metabolize caffeine in the same way as adults do. And if a pregnant woman is drinking caffeine, that can affect the brain development of the child, as well as if the woman is breastfeeding, that also can affect the child's brain. So it's important for vulnerable people who have underlying heart disease, and they may remember half the people don't know it because
Exactly.
1 in 300 young people have an underlying cardiac condition that could potentially put them at risk for sudden cardiac arrest.
Sure. And I think of maybe you stop seeing pediatric cases most of the time at age 18. So we wouldn't talk about college students or military recruits, but there are high schoolers who, they stay up late studying and then they're tired and they want to be jazzed up for their game and they're drinking energy drinks. Protein powders can sometimes have caffeine, yeah? And Adderall used to be a drug for ADHD that they were finger pointing.
Well, there are a lot of things. I think, first of all, the 18 to 21 to 25 to 30-year-old is pretty much the same as the 14 to 16-year-old as far as the body chemistry. And so we do see some of those children and young adults, and the same recommendations hold for them, but they do have more stresses, and so they're staying up and they're studying all night. But we do still advise that one needs to know what they're putting into their body and how much activity is also appropriate. So we want everyone to be healthy, to exercise, to be aware of what they're eating and eat healthy foods. But there are a lot of foods that also will add caffeine to them. But the workout powders, it's not the protein powder per se, but they have protein in them, but they have a lot of caffeine, and then they say 1 scoop, and the young people think, oh, I'll do 3 scoops.
Two's better, yeah.
And the military recruits, there have been a number of deaths with the military recruits because they're trying to keep up and meet all the requirements of the military, and that's great, but we need them to be alive.
Live. We need them to be alive. That would be helpful. Let's take a little break, and when we come back, more about sudden cardiac arrest in children and young people. Welcome back to your Radio Doctor. We're so pleased to have special guests today. Frank DeSimone shared a very beautiful story about saving his little baby's life, and Dr. Victoria Vetter from Children's Hospital has spent her entire career trying to educate the public and her patients about the importance of CPR and finding children with abnormal heart rhythms and propensities to have sudden cardiac arrest. Vicki, I wanted to touch on one thing before we move on. When a woman is pregnant, we do ultrasounds of the developing baby, and sometimes you capture abnormal heart structures that way. I should save that for later, because I was going to say one of your big passions is getting children screened, all children, not just athletes. Well, I'm going to put that on the back burner for a second, but let's talk about the steps of CPR. Frank outlined beautifully what he did. Let's talk about some of the nuances there and how it's different from adult CPR.
Right. So Frank told a wonderful story and very clearly expressed what needs to be done. So with the llama here, you want to make sure that you have your thumbs or your 2 fingers right on top of the hard part of the breastbone, and that's between the nipples, and that's easy to see on a child. And you want them on a flat, hard surface. So take them out of the crib, take them off the bed, off the couch, and put them on a hard surface, because you're trying to compress the heart between 2 hard parts so that you'll push the blood out. And then you don't want to lean on the chest. You have to have what we call recoil, let the blood flow back into the heart naturally, and then you push it back out again. But the thing that Frank told me in the break that he did mention is that he did give breaths. So after 30 compressions, he gave 2 breaths, and then 30 more compressions, 2 breaths. And that, the brain was not without oxygen, because he put oxygen back into the baby's blood, and that's a very important thing, particularly under a year of age, but we generally say until puberty, particularly if it's an unwitnessed arrest, because you don't know how long the child has been down, you should do 30 compressions and 2 breaths. After that, you can do what we call hands only or compression only CPR, because we do have 5 to 6 or 7 minutes of oxygen in our blood, and EMS hopefully will be there by that time, and they'll have a bag. A lot of the AED kits have a mask, or if it's your own child, you're obviously going, or relative, you're going to go ahead and do mouth-to-mouth that way. But the compression-only or hands-only CPR is 100 to 120 compressions, hands interlocked, elbows locked, your body right over the person so that the center of gravity is pushing straight down on the breastbone, the bottom third of the breastbone, and that goes for children too. So for someone who's under a year of age, you can usually get your hands around or use 2 fingers or even the heel of your hand. But once someone's older, you want to use the interlocking hands and be up as close as you can to the body and pushing down 100 beats a minute. We always said to Staying Alive by the Bee Gees. I know that there are a number of other 100, 120 beat per minute songs now that the young people know that I don't know even their names, and I can't understand what they're saying. But But you can use any, just count in your head. And on someone who is a teenager, someone with a witness arrest, unless it's a drowning when you know that the oxygen is gone from their blood, or they've had an asthma attack or some other respiratory problem, then you give the breast. But otherwise, you can do the compression-only CPR, and hopefully EMS will be there about the time they've run out of oxygen, so to speak. But it's important to recognize a cardiac arrest, to call 911, to start CPR, and to get an AED if there's one available. Unfortunately, 70% of arrests occur in the home, and yes, I have an AED in my home, but a lot of people don't. My neighbors know that that's the case, and there are, a lot of places, fields and so forth, that do have defibrillators, and we can talk about that maybe later. But call, push, shock, so call 911, push hard and fast in the center of the chest, and then get an AED if it's available. And it's pretty much like a Fisher-Price toy. It will talk you through. So don't pay attention to the signs that they have at the airport that say only for authorized people. That's because the manufacturers think they have some liability. But there's something called the Good Samaritan Law, and you all are protected by doing CPR on the street to anyone unless you're doing something that's willfully wrong. So I encourage everyone to watch some of the videos. We have YouTube videos as well from the Children's Hospital that we've made for infants and for children particularly, and for adults, and how to use an AED as well. So I think that's the steps.
Yeah, it's wonderful. And as you say, you never think it's going to happen to you, or you think that I'm a doctor. And 7 times in 5 years, I was called to do CPR. I was at a big luncheon. I was at the art museum another time. Twice on a plane, snakes on a plane, CPR on a plane. And I was very happy that Wendy Wonder Woman, the EMT, happened to be on this one flight, because the kit to save the patient had an IV that might fit into a Barbie doll, but we saved both people on the plane, 2 different planes, and it does make you a little sweaty. So I can imagine a layperson feels even more challenged. But Vicki, you make a very good point that it takes primary prevention and secondary prevention. And I want to give you a chance to talk about Youth Heart Watch.
Thank you. About 20 years ago, we started a program at the Children's Hospital called Youth Heart Watch after a young man passed away at the half of a basketball game in the Poconos. And if any of you have been up there, you know that your cell phones don't work too well, so they couldn't call 911. They had to wait to get in this brand new school into a locked office to get to a landline to call 911. So in the meantime, nobody was doing anything for this young man. And when they got to the hospital and it was too late, the nurse said, "It's too bad they didn't have a defibrillator." And the mother said, "A what?" And she explained that those are devices we call automated external defibrillators, and they are required to be in certain places, such as health clubs and fitness centers, but in the state of Pennsylvania, they're not required to be in schools. In fact, across the country, only about a couple dozen states mandate that we have AEDs. Fortunately, about 40 of the 50 states do mandate that we teach our students how to do CPR and use an AED, but fewer mandate AEDs. So there is a bill that will be introduced into the Pennsylvania legislature this spring, and I hope that we will be able to get this through so that all of our schools in Pennsylvania will have AEDs. But when that young man died, his family did get the state to pass a law to provide 2 AEDs for each of the 500 school districts. In a city like Philadelphia, there are over 300 schools, so the 2 AEDs didn't go. It was not, only 2 schools. So we were able to, with our Youth Heart Watch group at CHOP, get the trial lawyers to help us as their philanthropy that year in 2001 to raise funds, and we were able to get AEDs in all the high schools in Philadelphia. The American Heart has been a great partner in helping us get AEDs and education to the schools. We were able to then raise funds through our Youth Heart Watch group to get AEDs in all the middle schools, and then the school district decided that they should have it in the elementary schools, and we've all been working with the schools to make sure that they're trained. But just having an AED is not enough, even though they're very simple to use. It's important to have a program. So we started within the Youth Heart Watch. We joined with other groups around the country that were similar, called Project Atom. And we have a program called the Heart Safe School Program that will provide a regimented way to have a program in schools that will provide AEDs, a response team, a cardiac emergency response plan, and we practice drills. So similar to what happened with Damar Hamlin when he was hit in the chest, and that's a way that a child with a normal heart can have, it's called commotio cordis, can have a cardiac arrest. The school will have a team that will be prepared to immediately jump into action and to save either a child or any grandparent, parent who's in the school. And when you have an AED in the school, the survival goes from 10% to 89%.
It's incredible. And as you say, it's you can't just have the AED, the automatic external defibrillator, in a plastic case on the wall. You have to have mock drills. You have to have a written plan. And I thought about it after talking to Frank in detail the other day. I thought, gee whiz, when people drop their children off the daycare, how do they know? Is that a regulation by the state that every daycare has at least one person trained? I don't know. I hadn't had a chance to look that up.
No, it's not.
And so all the more reason to get this message out. And with the help of the American Heart Association, Trish Bradley, this month in particular, we're really trying to rev up the information and tell people, even if you just do this, it's better than doing nothing. And those minutes, the ticking clock should match a ticking heart. And there's a new campaign for you, Trish. But I want to come back after the break and learn more about Youth Heart Watch. And very briefly with Damar Hamlin, people say, wasn't he checked before he passed out? But any healthy person, am I right? Correct me, Vicki. When we're watching an EKG and there's a spike and then a little lump, that it's a regular lub-dub. If you get hit in the chest with a baseball, if you're a catcher, or a football helmet like Damar Hamlin, and it gets it right at the exact millisecond where the lub meets the dub, anybody can have a cardiac arrest. And you watched him, he passed out, he stood up, and you could see him swerve. When somebody comes to the ER and they've had a trip and fall, we know that if they have a broken wrist with it, they probably were alert when they were in the fall and they try to protect themselves. If they come in with facial injuries or head injuries, they say perhaps they passed out before they hit the ground, and that's why they fell. And Damar, you look at the video, he stands up and he goes, weeble wobble, and he goes out again. So he probably was in his commotion cordis, commotion heart, yeah?
Yeah, so it's 20 milliseconds just right on the top of the part when the heart is trying to recharge and get ready for the next beat, and that will cause the heart to go into this quivering or ventricular fibrillation, and that's what happened. But within a minute, that defibrillator was on his chest. He was getting CPR.
Thank goodness.
And he's, back on the field now.
Yeah. Let's take a little break and we come back. More about CPR in children. And welcome back to our final segment of Your Radio Doctor. We're learning so much about the importance of CPR in all people and how it's different when we perform it in children and infants versus adults. Vicki, you've spent so much of your professional career educating, making sure AEDs are in the schools, making sure schools have a plan and they know how to have mock drills and all those good initiatives. I also really love your proposal that children are screened at a regular basis. In the hospital, if a baby's born, as soon as we pick up the baby and smack their little bottom, you want to check their color, their heart rate, their breathing. You make sure you can pick up in an infant or maybe in the mom's ultrasound during pregnancy. So your recommendations are what? To screen at birth and then when again?
Right. Well, because there are these hidden conditions that children can have, and because they really can't tell us what's going on for quite some time, and they don't know to tell us often. Other countries around the world, notably in Japan and in Italy, have been using the electrocardiogram as a method to look into the heart of these children. And so in the 1970s up till now, the Japanese have been screening first graders, seventh graders, and 10th graders. And when you think about that, the time that our children develop and become, teenagers, the body is changing a lot. And so some of these conditions do not actually show up until children go through puberty, and then there'll be more evidence. So the reason that we need to screen them over their childhood is, just as you recall, when you go to the pediatrician, they'll give you certain advice, they'll do certain tests at different points in the child's life. So my pipe dream, I hope I live to see it come true, is that we would do an electrocardiogram on the 6-week-old, and we would find those conditions that would cause sudden infant death in about 10%, but that 10% is precious. That we would do this when we screen for hearing and eyesight and so forth when the child goes to school, when they're in middle school, about the 7th grade, and at about the 10th grade. In Italy, since the 1979 AEDs, they have been doing screening in athletes. I firmly believe that it should be in all children, because all children are athletes and active, but they've been doing screening between 12 and 35 for any kind of sport, and they have decreased the incidence of sudden death by 89% over a 25-year period. And you might ask, why in this country don't we do that? There's a lot of controversy. We're moving the needle. We have done what's called the pre-participation physical with 14 points that we ask certain questions, those warning signs and symptoms, and do certain aspects of the physical exam, listen for a heart murmur. But the electrocardiogram is 5 times more likely to show one of these conditions than either the history or the physical. I firmly believe that you should put it together. We've been doing a heart health screening study for the last 15 years, and there are other folks around the country who have now joined into this in a screening study underneath the auspices of the Parent Heart Watch, a group of parents who, unfortunately, many have lost children or had children who've been saved, and are coming together to try to get enough scientific data to bring that evidence base to the public and to the medical community, so that we will be able to do some type of regular ECG screening that becomes the standard of care for pediatricians.
Now, when there is an episode of a sudden cardiac arrest, is that reported to state or federal level to help you keep track of data?
No, we're not counting our kids.
And
we need to.
Yeah. Do you think that would help? I would think
Absolutely,
tremendously.
yeah.
Because and maybe that would be more convincing evidence to get Harrisburg or that it's a. I mean, it is the number one cause of death in adults in the U.S. heart disease, and the examples you're giving are. And the other important point: not just athletes, all children run around the schoolyard or play or exert themselves, and really it doesn't necessarily have to involve a sport.
So there are some databases. There's the CARES database, Cardiac Arrest Registry, and the NIMSIS database. These are EMS, Emergency Medical Services databases. So we have some data, and that's been very helpful, and that's where we've learned that we need to do breaths on children under certain ages, that we need to press at a certain rate. And so all that evidence is important, and we do have some. It's not that we don't have any, but we need more evidence, and we need to listen to what is being done around the world, because that's important.
So if young parents like Frank want to learn more about Youth Heart Watch or all the CPR initiatives with American Heart Association, the website is heart.org. Is there a website for Youth Heart Watch?
Yes, we're underneath the chop.edu, but if you put Youth Heart Watch at the Children's Hospital of Philadelphia into Google or whatever your search engine is, or if you put that into YouTube, the videos will come up. Mm-hmm. So, and I have a wonderful coordinator who will call you back if you want to refer your school for a heart safe school. We will call the school. We'll arrange to help them work through the different steps to become a heart safe school. And we will go out and have a screening drill. And when they meet all of these requirements, they get a nice banner that says, Youth Heart Watch at the Children's Hospital of Philadelphia recognizes our first school was Cornerstone Christian here in the city. And they will have this banner to hang up and show their community that they have realized the importance of this. And that school did have a parent who was in line waiting, for a child that they were able to respond to 5 years after the original training.
Wow. So is there a phone number people could call to learn more information? If not,
I don't have it off the
That's
top
okay.
of my head. But there is, if you email Youth Heart Watch at CHOP, I think it is.
Sorry. Well,
Youth Heart Watch
Children's
at
Hospital,
chop.edu.
and you open the website and you can find Youth Heart Watch. We'll put it on our website. How about that?
Yeah, I can-
And then when
I
we
can give it to
promote
you.
the show and post everything and watch on YouTube, or we'll put the phone number there. Is there anything else that Frank or Vicki you'd like to add, or a take-home message for our listeners?
I'll just reiterate what I said. Take the CPR class, even if you took it 20 years ago, even if your workplace did it. It really is the difference between life and death. And look, I would have thought I'd be one of the least likely people to ever be speaking about this topic. But here we are. It can happen to absolutely anybody. As we've heard today, old, young, in shape, out of shape, right? This affects everybody. And CPR, it's something easy that we can all do. It can literally save a life.
I've talked a little bit about educating our children, but no child is really too young. We can teach our 4, 5, 6-year-olds how to call 911. They're
Good point.
masters at the phone. And,
Yes, they are.
And teach them your address and teach them grandma's address, because when they get asked, where they are, you don't want them to say home.
That's a great point.
So it's important to do that part, and then the rest of it can be part of the curriculum.
Beautiful. Thank you so much. We've learned so much, and I'm sure that our listeners feel a little more confident. That's the whole point of this. And we thank you, and we thank the American Heart Association for helping us to coordinate the show.
Thank you very much.
Thanks.
Thanks for listening to your Radio Doctor every Saturday afternoon at 5 here on Talk Radio 1210 WPHT. Listen to all of our shows again at your convenience on Odyssey.com, AUDACY.com. And now every show is on YouTube. Search Your Radio Doctor and please subscribe to our YouTube channel. It's free, it's easy. Go to YouTube and search Your Radio Doctor and please click on subscribe. It's free. Our listenership continues to grow. We invite you to partner in the show as a sponsor, and we'll help share your message. Contact me through email, info@yourradiodoctor.net. Send an email to info@yourradiodoctor.net. We know, again, February is Heart Month, and we celebrate Valentine's, and we all want to work toward a community with healthy hearts. Thank you to my friends at the American Heart Association for helping with today's show. Visit our website, yourradiodoctor.net, and learn how you can support their efforts with their many initiatives, including Go Red for Women, to help fight heart disease in your mothers and wives, sisters, aunts, grannies, daughters, and all the beautiful women in your lives. We continue to pray for peace in our world, peace in our beloved country, in our families, and each of our own hearts. This is your Radio Doctor, Dr. Marianne Ritchie, sending you love through February and the entire month, every month, and wishing you a happy, healthy, and safe week with the ones you love, and always here to remind you that your health is your wealth.
Thanks for listening to your Radio Doctor, Dr. Marianne Ritchie, presented exclusively by Independence Blue Cross. To contact Dr. Marianne and to listen to today's show as well as past shows, visit yourradiodoctor.com.